The topic of my talk was spatial analysis in breast cancer to predict outcome on immunotherapy. And it's really early days if you really look at spatial analysis in relation to immunotherapy, only a few papers. So what I did in my talk, I provided like some basic principles on spatial analysis. So basically on the technologies and whether the technologies are on DNA, RNA or protein level and what it's doing. So what the spatial analysis in a nutshell is doing, it's not only providing information on what kind of cells are present, but on two other things. How are cells related to each other? Are they really close to each other? Or is there a big difference? Or is there a certain barrier between cells, for example? That's one aspect. And also, you can have information by using spatial analysis on the cell state. So do you have a T cell can sit in the tumor but can also do nothing. So is your T cell, for example, active and able to kill a cancer cell? So that are really the advantages of spatial analysis. What I did next in my talk is, discuss some landmark papers on spatial analysis, either protein levels or spatial transcriptomics in the breast cancer field and what it could yield. Then I provided a snapshot on where the field of immunotherapy stands, so looking at studies in melanoma, sarcoma, for example, or lung cancer. And then I provided some information on, examples of how it could be used for breast cancer patients. And regarding to that later topic, so there are now, I think, 4 trials that reported some spatial information, and they said it's really early days. But we've seen in the metastatic setting 2 trials in PASSION 130 as well as in the TONIC trial, that the spatial organization of the T cells or the CD8 T cells could matter. So those patients where the T cells are really in the tumor and not only in the border, they have better outcome on immunotherapy for metastatic triple-negative breast cancer patients. In the early setting, we've seen some data in the I-SPY, but it didn't show a particular pattern in terms of cell organization and outcome on pembrolizumab. However, I think the most advanced data is coming from the NeoTRIP study. So an Italian study where they used chemo plus immunotherapy. And they really elegantly showed, for example, that it really matters where your B cells are and where the plasma cells are, because those seem to be determining the response to immunotherapy. So in summary, we have bits and pieces of data of complex technology, but I have high expectations in the coming year we will see more in that field. Papers on technology, but also papers on really addressing the question, can spatial technologies help in selecting patients for immunotherapy outcome? But it will be the far future before we can use it in the clinic.